All right, good afternoon, everyone. I would like to welcome you to the Division of Healthcare Financing and Policies Fall Stakeholder Update Workshop. My name is Melinda Southard, and I'm a Deputy Administrator here at the Division. As a reminder, this meeting is being recorded. Thank you all for joining us today as we go over some updates, activities, and timelines on some of the major projects we've been working on. So I'd now like to like to introduce you to our administrator, Stacy Weeks, who will be kicking off today's workshop. So Stacy, please go ahead when you're ready.
Thanks, Melinda. Good afternoon, everyone. Thank you all for being here today. I see we have over 100 people, so that's exciting. We're happy to give you guys an update. We are now, it's almost the end of the year for 2024, so we have a lot here to present, so we'll go ahead and get started. Next slide, please. Just like we've done in the past, we started doing these stakeholder meetings really to give you guys an update and progress on major projects that we're working on at the division, as well as implementation of all the legislation that was passed last session in 2023. And then also to answer questions and gather any feedback from folks after the call. Next slide, please. So today we have a lot. I think it's over 45 slides or something, so I'm not going to spend too much time on this slide, but just, letting you all know that we hope to walk through, obviously, the major projects, legislative updates, the PPC updates, and just some opportunities for other stakeholder engagement that we have at the division. Next slide. This is some of our values for the work we've been doing. As we moved out of COVID, a lot of our focus really started to shift into how do we do what we do? We have a lot more people covered, I think is where to start here. And so how do we do things more efficiently? And also, how do we do that with a mind for fiscal stewardship? Because we are the largest portion of the state budget. And so how do we make sure that we are getting the best value for the taxpayer dollar? So that's a lot of our piece of our work now. And then looking to really engage, during COVID for 3 years, we were all kind of locked inside, and now we're out, trying to make sure we have that community and provider partnership in our work. And obviously, as always, trying to keep the people that we cover and serve as first in our mind. Next slide, please. We have a full team. I'm excited to say that. I don't know if I said that last time on the stakeholder call. We continue to grow. Patient Protection Commission is now under our house, and Joseph Felipe is our executive director for the Patient Protection Commission. As you can see, we have all of our deputies' roles are filled. Jennifer Krupp, I think, probably was not on the last stakeholder call. She is our new fiscal deputy. And Ann Jensen recently joined us as our innovations officer, and she's overseeing, really kind of leading in the project management and spearheading some of the work around the Children's Behavioral Health Transformation Project. And I think you guys all know Dr. Benson, Dr. Clemens, as well as Dr. Duncan on our team. But I think if not, Dr. Duncan is our new pharmacy director for the division. Next slide, please. So just stepping back to kind of look at Nevada Medicaid and where we are today. For those of you who may not know, we are a taxpayer-funded health insurance program for over 800,000 people in Nevada. We cover a core set of benefits at no cost to individuals, and a lot of it's because they are low income. And that is also a federal requirement. We cover so today it's about 1 in 4 Nevadans, and nearly half are children. And we cover 1 in 2 births in Nevada. And we are also the payer of last resort. We make up about a quarter of Nevada's insurance market. So you can see there in that pie, we are 22% of the market in Nevada when it comes to coverage and coverage programs. We're the largest source of federal funds for the state and for healthcare. And we create policies for payment, really driving, like I mentioned earlier, we're trying to look at how do we drive performance and outcomes in our system. Next slide, please. Right now, we have a lot of priorities. I mean, there are more, honestly, than this list, but this is really the ones that really kind of raise up right now for us as we move into the legislative session next year. Really looking to reduce administrative burden for providers, improve access to community behavioral health, improving maternal and child health. I think I don't know if all of you saw, but Commonwealth Fund put out a study recently that found that Nevada ranks 48th in the country for maternal health outcomes. And so we know we can do better. Support access to care for rural communities and modernize how we pay for healthcare to drive outcomes. And last but not least, improving access to preventative and primary care in our state. We do have a really big access issue for primary care in Nevada. Next slide, please. All right, I'm going to turn it over back to, I think it's Melinda, or no, is Vanessa for for the public health unwind. Thank you.
Thanks, Stacy. Good afternoon. My name is Vanessa Ramey. I'm the project manager overseeing the Public Health Emergency Unwinding Project. Just a quick refresher for those who are not aware, this project primarily unwound policy flexibilities that were placed during the COVID-19 pandemic, which included the continuous enrollment condition. I'm happy to announce that the unwinding period as it relates to the renewals has ended as of August 31st of this year. The timeline that you see highlights events that occurred throughout the unwinding period. As you can see, we started our unwinding period April of 2023. However, due to our ex parte mitigation plan, we had to reinstate recipients who were terminated going back to April. Mid-September, so that was mid-September, and then decided to pause disenrollments, which went through December until ex parte was corrected. And then as of January of this year, we restarted the unwinding or the renewal process, and we completed all the renewals as of August 31st of this year. We have some key statistics. So as you can see, Medicaid's peak enrollments had over 900,000 recipients. After completing renewals, we disenrolled about 300,000 recipients. Half of those were due to procedural reasons, and nearly half have re-enrolled as of today. And now our Medicaid enrollment sits at about 800,000 members. We're still working on some unwinding activities, which include reporting to CMS. Our final CMS reports conclude December 31st. And with a final report regarding our unwinding efforts, this project will conclude as of January of 2025. And that's my update. I'll take any questions if you have any.
Thanks,
Thank
Vanessa. We'll hand it off to Cynthia. Or actually, I think Ashley, sorry.
Yeah, it's Ashley. Well, hello. Thank you for that introduction there, Melinda. As Melinda was saying, my name is Ashley Barton, and I'm the project manager overseeing the All Payer Claims Database implementation efforts here at DHCFP. Today, I'm going to walk through some key milestones we've reached and what is ahead for APCD. As many of you are already aware, the APCD has been a long time coming now, and DHCFP has been working with the vendor over the past to get to where we are at now. To begin, everyone's favorite topic, regulations. They were finally taken and presented at public hearing on October 1st, 2024, to gather some valuable final input and ideas from our potential data submitters. Next, the proposed regulations will head to the Legislative Commission Board meeting on November 15th, just a few days away. We're really excited. This is where we keep our fingers crossed and hope that they will love what we put together for them. And once the final regulations are approved, we can officially kick off the implementation phase we've been preparing so hard for. This will be a phased approach, so you'll know what's coming up at each step. On December 9th, the initial submitter registration opens, along with the launch of the Claims Data Manager portal for all of our data submitters. Starting also on December 9th and going through the end of March 2025, there will be various webinars that will be conducted, and one-on-one trainings will be provided for all of our data submitters. We will be holding your hand through this process, so don't worry, we are here to help. And February 7th of 2025 is the registration deadline for our data submitters. If you haven't signed up by this date, this will be the last call, so don't be the last one to the party. And finally, July of 2025 will be the data submission deadline, which will include 3 years of historical data plus the current calendar year. So it's like Christmas in July, just with a lot of data. And there you have it, folks. This is what the next 9 months look like. Somewhere in there, we'll be standing up the website as well as the final phase of implementation. But the final phase of implementation won't be launched until the end of next year, once we have that snapshot of data with all of the analytics that we'll be able to put together. So if there aren't any questions, I'll go ahead and pass this on to Cynthia Leach to provide a few updates related to centralized credentialing.
Hi, everyone. Good afternoon. I'm Cynthia Leach, the Compliance Agency Manager for Nevada Medicaid. Nevada Medicaid has contracted with the credentialing verification organization VeriSys to perform credentialing and recredentialing activities for Medicaid providers who contract or intend to contract with one of our managed care entities. Fee-for-service only providers are not included in this initial implementation, but once managed care expansion is complete, they could be rolled in. The primary goal of this project is to establish a one-stop shop for the Medicaid credentialing process and to improve credentialing application turnaround times. Nevada Medicaid is also partnering with the Division of Insurance and stakeholders to improve the credentialing application, also known as the NDOI 901 form. As part of this project, we've recognized that the current application is quite lengthy and cumbersome and also contains somewhat invasive questions. So our goal is to make the application more efficient, not only for Medicaid, but across all Nevada credentialing. We are on track to implement this project by March 2025. So please keep an eye on the link listed here for more communications to come. We will be posting FAQs soon. And happy to answer any questions either now or at the end of the presentation. And I believe I have this slide as well to talk about the new provider enrollment experience. We're really excited to announce that we are developing a new provider enrollment portal aimed at improving the way providers enroll in Nevada Medicaid. The portal will have a new look and feel, and goals include updating the user interface to streamline the application process, implementing DocuSign as the e-sign solution, incorporating provider checklists into the portal, automating license workflows, and ultimately just improving the application turnaround times and reducing the need for applications to be returned for correction. We will be reaching out to select providers for pilot testing at the end of the year, and full implementation of this project is slated for early 2025. Just keep your eyes and ears open, more communication to come on this, including project timelines and training opportunities for providers. And I'll turn it over to, I think it might be Anne next.
Yeah, thanks, Cynthia. Hi, all. Ann Jensen here. Excited to share a few updates on our children's behavioral health transformation. So this visual may be familiar to many. We've been really trying to share this in as many forums as possible over the past about 4 or 5 months. We're really excited about all that we're doing to strengthen our behavioral health system for youth and families across the state. We know there's a lot of opportunity for improvement, particularly in the range of services that are available to our youth and families in their homes and in their communities. Our goal here is to ensure that youth are able to receive the care they need at home with their families and in their communities wherever possible to avoid that's necessary. So you'll see a list here of benefits. Some of these are existing Medicaid benefits that we're looking to enhance or increase reimbursement for. Others are new benefits altogether, things like wraparound services and respite care for caretakers that we're really excited to begin developing and rolling out in the coming year. So Melinda, if you want to move to the next slide, this really shares kind of what our timeline will look like. This is a multi-year effort that we have over $200 million of funding to develop and strengthen the system of care. the whole time, we are really going to be working closely with our community members and providers. We know it's a really meaningful opportunity we have, and we want to do right by it by really listening to feedback from you all to ensure that the system that we're building works for our providers and for our youth and for our families across the full state. So 2 weeks ago, we launched a working group that represents a number of family and youth voices, as well as providers that will inform the development of each and every one of these benefits. Those are open to the public, so if you're interested in joining, we'll share information on the next slide. But really, we're spending the next year focusing on developing those new and enhanced benefits and strengthening our provider workforce to be able to deliver those benefits. We're also developing a new way to essentially deliver care through a specialty managed care plan that will launch in January 2027. This will cover all medical and behavioral health benefits for eligible youth. We are really working to still develop and design this right now, so welcome input from all of our community on this process in the coming months. That will be available through our working group meetings and other forums as well. So I think I have one more slide, Melinda, on the next page. Just to share how to get involved. We're still on the relatively early stage of this multi-year project. We're really eager to hear from you all on how we can implement this as quickly and as meaningfully as possible. So our working group meetings, I mentioned, kicked off last month. Our next meeting will be the first week of December. All of those will be shared via our behavioral health listserv. So if you're interested in learning more, if you're not sure if you're on that listserv or not, feel free to send an email to childrensbh@dhcfp.nv.gov, the email address in blue at the bottom of the slide, and we're happy to get you added to that list so you can hear more about the working group meetings as well as more general community meetings that we'll hold on more specific topics in the months to come. So looking forward to sharing those updates. And with that, I will turn it over to Sarah.
Thank you, Anne. So lots of exciting stuff happening in the world of behavioral health, as Anne mentioned. I'm going to spend some time talking about some of our additional behavioral health projects as well. So first up, I think on our last stakeholder meeting, we were still waiting on a state plan amendment approval for our crisis services. So I'm so excited to announce that state plan amendment was approved back in July, I believe July 29th. And that state plan amendment allowed for reimbursement of intensive crisis stabilization services that are performed in a facility-based, either a crisis stabilization center where a hospital has an endorsement as a crisis stabilization center, or a community facility-based provider performing intensive crisis stabilization services. The effective date goes all the way back to March 30th of 2022. We've been working on that state plan amendment with CMS for quite some time. The other piece to that state plan amendment was to allow for reimbursement for a new type of mobile crisis model that was developed by the Center for Medicare and Medicaid Services. And so those requirements comply with Section 1947 of the Social Security Act and allow for states to be able to reimburse for a certain type of mobile crisis response. Some of those requirements include a team-based response for mobile crisis, so it has to be more than one person. Also, it has to be an in-person response, so at least one of the team members has to be in person. And then also requires for that 24/7, 365 in-person response. We are doing quite a bit of work still on our crisis services, so there's definitely more to come in the world of crisis. We did develop a brand new provider type 87, that is solely for providers performing crisis services. So there are a couple specialties that are available to enroll in currently. And then we're also working in the background on some additional specialties as we further develop enrollment criteria. Next slide, please. All right, the next couple of slides, I'm going to talk about our newest proposed benefit. This is a health home model. It's brand new to Nevada, but we're super excited to propose this model to CMS that I'm aware of. We are the first to initiate a health home that is specific to Medicaid beneficiaries with fetal alcohol spectrum disorder. So this was all initiated by Assembly Bill 137 during the last legislative session. And the goal is to be able to address gaps in care for individuals with fetal alcohol spectrum disorder by being able to provide comprehensive care management and coordination services to these individuals. So there's two ways to become eligible for this health home. That is either from a confirmed diagnosis with a specific diagnosis code related to FASD, or a probable prenatal exposure that's been determined by a clinical professional or self-attestation. Largely, individuals with FASD don't qualify for waiver services in Nevada and go without necessary services and supports. So the goal here for our FASD health home is to be able to address the unique needs of these individuals who are on the spectrum. Next slide, please. These are the list of the 6 core services that are available under a health home model. We are getting ready to submit this to CMS at the end of the year. So we're proposing an April 1st, 2025 effective date. And with the build of this model, we're also considering the build of an additional health home to support pregnant women that are struggling with substance use disorder or opioid use disorder. So that will be coming hopefully on board in the coming years. Next slide, please. All right, so one of the next larger projects, I'm sure you've all heard me talk about, our 1115 that we currently have approval for, that is focused on reimbursing for substance use disorder treatment within what's known as an institution for mental disease for the age range of 22 to 64-year-old individuals. We did receive approval of that back in August of 2023, so that individual or providers performing these ASAM levels of care are able to receive reimbursement for those ASAM levels. What we've been recently working on, and we recently have received a state plan amendment approval for, which I'm excited about, is redeveloping our payment methodology for these levels of care. So there is still some work to do within our system to make sure that that is in fact reimbursable, but we do have the authority now. So hopefully by the end of the year, that should be good to go, and providers performing those levels of care can be reimbursed based on a daily rate using one code as determined by each level of care. The next piece I want to mention on this is we have been working hard on amending this 1115. So we know we currently can reimburse for those seeking substance use disorder treatment. What we're going to amend about this 1115 is to now include our seriously mentally ill population to also receive care in what's known as institutions for mental disease. We've also added in some health related social needs services to eligible members. So I encourage everyone to go to our public notice website and check out our amended application. Our goal is to submit that mid-November in hopes for an effective date of January 1st, 2025. And please provide any public feedback if you read through and you have anything you want to add. Thank you. I'll turn it over to Kirsten.
Thanks, Sarah. So I'm just going to give a couple of updates related to our non-emergency medical transportation, NEMAT. So we are always looking at ways that we can improve our transportation. And so one of the areas that we really wanted to focus on is the rural areas. And so with the expansion to statewide managed care that would happen in January 1st of 2026, we will be having those the transportation services for the managed care members in the rural areas actually transfer over to the managed care entities, in hopes that they will have a closer opportunity to provide those transportations in that rural area. So that will not be happening right away. So again, it's January 1st of 2026. And so Nevada Medicaid will still provide transportation statewide. So members that are in the rural areas that are not on managed care, but will be still remain fee for service, we will still be providing those transportation services through our non-emergency medical transportation vendor, MTM. And so we will certainly have lots of communication regarding this change as it gets a little bit closer. We'll be updating our state plan pages, updating our policy, and we'll have public engagement sessions for those. But we did want to just share those opportunities that will be coming up. And then the other thing that we're looking at really to try to help increase the provider network for transportation providers in the rural areas is looking at the CMS flexibilities related to deadhead trips or unloaded miles or empty trips, however you want to say it. So we will be seeking federal authority to do that, also in that 2026 timeframe. And so CMS had issued some guidance last year of ways states can look at that flexibility. So we'll be seeking technical assistance from CMS to see how we can add that to our benefit package. And I think that will really help try to address some of the challenges that we see in our rural areas, which is not unique to Nevada, but certainly something that we want to address. And then the next slide. So the other update I wanted to give is regarding our electronic visit verification system, EVV. So as many of you probably know or maybe directly use, we did switch our vendors back in December 15th of 2023. And then we also added home health services, had to use EVV effective January 1st of 2024, so this year. So we're continuing to work with SanData, ways that we can improve that. I will say the Optum outage that had happened earlier on this year, that is no longer an impact. So that is great news. So all providers can bill through their respective EVV system. So either the state system, which is the SanData system, or if a provider has their own system as an alternative EVV user, then they should have no impact to using that system to be able to bill for those services. And then as many of you might be aware, or maybe perhaps not, when Optum was offline from about February until July, the division wanted to ensure that recipients did not have any interruption to their services. So we did issue advance payments. And so we're starting that process to have providers submit their claims so we can recoup those advance payments. If there's any questions regarding those advance payments, we do have the email on here at the NV Recovery. We're happy to answer your questions related to how that might work, since it might be new. And then just wanted to also share our NV EVV inbox. We still have that. So if there's any questions just related to the EVV system kind of as a whole, or challenges that you might be experiencing, please reach out. We're happy to continue to be liaison with SanData and Gainwell. And we are just hopeful that the process gets a little smoother for all the providers continuing going forward. And I will turn it over to Stacy.
All right, thanks. Thanks, Kirsten. So just a quick update on the private hospital provider tax program. We are in the second fiscal year of the program, state fiscal year 25. I hope I got that right. As you can see here, the total that's going to be going out minus the tax paid is about $830 million. And that is a big difference to as you can see, as compared to the previous model for the last state fiscal year. The big difference here really is the fact that we are able to include the supplemental payments on the managed care side for 12 months. And so the first tax program year only included 6 months of that managed care, what we call state directed payments, but they're essentially supplemental payments in managed care. So that's really the big piece here, and as you can see, but also utilization is going up. So that is driving a lot of this. Next slide, please. This here is something that was sent out to all of the hospitals. We just want to make sure everybody has it. This is the schedule for the provider tax assessment and when the payment is due. And then obviously it includes our UPL payment, which is our supplemental payment for fee for service on inpatient, outpatient, as well as state directed payment timeline on the managed care inpatient and outpatient hospital claims. So if anybody has any questions on these, you can definitely reach out to our team and let us know, but hopefully everyone already has this and it's just redundant information. Next slide, please. All right, so I wanted to kind of take a step back to the nursing facility provider tax and payment program. There've been a lot of questions come up recently around a lot of the changes. And I think it's important to note since the last legislative session, which was in 2023, three big changes occurred. One was obviously the rate increase to the base rate for these services. It was about a 24% rate increase. That definitely went into effect and we have implemented that on our side. The other piece that is new is as part of the budget, when it passed, did include a request that we seek what we call FMAP claiming funds. And they're really just additional federal funds that we can claim for any individuals that might have actually been served by a nursing facility who were adult without children, which means that we would get 90% of the federal funding. And so it's additional federal dollars that we typically would not be paying out on the supplemental side. So it's really kind of taking that small piece and that additional fund and then sending it back out to our providers. And so that's something we did get approval for, and we'll talk about that here in a second. MCO claims is the third piece that's different, and it's a big change. So for many years, we've been sending out supplemental payments on the managed care side for this program, when really it should not have been done that way. We should have been sending them as what we call state-directed payments. We cannot supplement managed care payments unless they're directed through the MCO program. So this is a federal law and has recently been updated as well. So there are new requirements around this. So I think a lot of the changes for the skilled nursing facility partners, there have been a lot of changes here, and it definitely feels like new, a lot of new pieces, a lot of new moving parts. So, and because it's very complicated, just like our hospital provider tax program, we have decided to begin working with Mercer to really develop a streamlined schedule and process for these payments and the calculations. And so hopefully for calendar year 2025, we'll be rolling out some more of that information to our partners. We're still waiting for CMS to approve our additional funding to pay more state-directed payments to the skilled nursing facilities on the managed care side. Until then, we cannot pay anything else out under the rules around the state-directed payments. We are going to hopefully be issuing additional FMAP claiming payments here soon. We'll be sending out information to our skilled nursing facilities by the end of this week about that timeline. Next slide, please. All right, Dr. Benson, I'm going to turn it over to you.
Good afternoon. My name is Dr. Keith Benson, and I'm the Nevada State Dental Officer here at DHCFP. And I'm happy to report the 1115 demonstration waiver titled Whole Mouth, Whole Body Connection for Adults was approved June 28th, 2024 by CMS. This gives DHCFP the authority to reimburse 5 dental encounters per adult diabetic eligible member at participating FQHCs and tribal health centers that are located across the state. We are currently working with our fee-for-service vendor Gainwell to develop the billing system for these dental services, which will include shadow billing for tribal health centers and FQHCs for the first time. These dental services will be reimbursed similarly to the pregnant adults in Nevada, so it's a very comprehensive dental benefit. Additional news is that we are able to add dental procedures to the ID waiver program, and we're now going to be covering care coordination, crowns, limited deep cleanings, and prevention services. And this was really based on members getting in contact with us and us listening to them and developing these new services. And a complete list of those added procedure codes are on the web announcement 3435. Okay, so now I'm going to pass it over to Jamie Evans.
Good afternoon. Thank you, Dr. Benson. I'm Jamie Evans. I'm the Chief of the Managed Care and Quality Assurance Unit. As you all know, we are expanding to statewide managed care effective January 1, 2026. The expansion will include roughly 75,000 adults, children, and parents in the rural areas. I'm very happy to say that we have successfully posted the RFP. It was posted on October 21st. And things are moving right along. We're currently in the Q&A period, and the bids from interested vendors are due January 3rd. 2025. We expect to have a notice of award in early February with a contract start date in early June of 2025. Additional information can be found on our statewide managed care webpage. It's linked on this slide. That webpage also includes a link to the RFP if anyone's interested in going out and taking a look at that. There's also an informational webinar on the managed care statewide expansion that is on the Health and Human Services YouTube channel, and that is also linked on our statewide managed care page. So we're just very excited for this process to continue moving along, and I will pass it back over to Melinda.
Great, thanks, Jamie. All right, so I wanted to talk to you all about the Battle-Born State Plans. So as passed through the Nevada legislature in 2021, now it's codified to Nevada Revised Statute 695K. The director of the department is required to contract with health insurance carriers to offer public option plans, which are now referred to as the Battle-Born State Plans, or BBSPs. These BBSPs will be listed as qualified health plans, also known as QHPs, on the Nevada Health Link beginning in plan year 2026. Among other stipulations, NRS 695K requires carrier submission of what is called a good faith bid to offer BBSPs if they would like to participate in the Nevada Medicaid managed care. The law also requires establishment of a reference premium along with a premium reduction target that is at least 15% lower than the reference premium over a 4-year time frame. It is also required by law that participating carriers pay their BBSP providers no lower than Medicare average rates for a service. And providers participating in the Public Employees Benefits Program or Medicaid also participate in at least one BBSP network in their rating region. Some statutory goals of the program are really aimed to reduce individual market health insurance premiums and those consumer out-of-pocket costs, improve access to high-quality, affordable healthcare, reduce disparities in healthcare access and outcomes, and improve the availability of coverage for our residents in rural areas. Along with the BBSP program, the director of the department is also directed through state law to seek a state innovation waiver under Section 1332 of the Affordable Care Act. This 1332 waiver program is referred to as the Market Stabilization Program and involves implementation of the following initiatives, including first, a state-based reinsurance program, which is aimed at alleviating any unexpected financial risk to participating carriers and their provider networks with the introduction of the BBSPs into the market. Second, a quality incentive payment program to reward those high-performing BBSP insurers. And thirdly is a Practice in Nevada program to provide financial incentives to providers coming to the state to increase the state's healthcare workforce capacity and address the significant imbalance between provider supply and demand in Nevada's market. In addition, Nevada will implement a targeted premium relief program for enrollees whose premiums increase due to the BPSP program's premium reduction requirements. Rate increases are estimated for some exchange enrollees at $5 or less, for less than 20% of the exchange population. Lastly, here we will go over some key dates and timelines for the BBSP program. As many of you know, the updated BBSP solicitation was released on October 2nd, with good faith bid proposals due October 23rd and technical proposals due October 31st. The division plans to send notification of good faith bid determination to interested vendors by November 6th this week, whereby interested vendors determined to have submitted a good faith bid will be eligible to proceed in the Medicaid managed care procurement. Nevada intends to issue a notice of intent to vendors around February 1st, 2025, with the following notice of award issued 1 month later around March 1st. Following Board of Examiner review and approval, BBSP go live date will be January 1st, 2026, where the BBSPs will be offered for purchase to consumers on the Nevada Health Link. Next, I'm going to transition over to Medicaid coverage for successful reentry for from correctional facilities. So this is talking about the division's reentry initiatives. We have 2 initiatives that we're working on in the division, both related to each a federal requirement and state requirement. So federally, we're adhering to the Consolidated Appropriations Act for providing coverage of youth services for those who are incarcerated. And then also, as was passed in 2023, the Nevada legislature, Assembly Bill 389, which requires the department to seek a federal 1115 waiver to support adults and youth up to 90 days before they are released from incarceration with specific services and supports to help them transition into the community. So coverage of these new services includes case management, the physical and behavioral health screening, diagnostic, and treatment services, prescription medications, among other things. So those services will be available both before and after release from carceral facilities. The timeline at first will be up to 30 days before they're released. Then once we get the 1115 waiver under our belt, then it will be up to 90 days before they're released. And then also that transition period after they're released with the case management. So those eligibility. Those will be Nevada Medicaid eligible incarcerated adults and youth who are up to age 21 or up to age 26 if involved in the foster care system. The new services for youth will be eligible for the Medicaid reimbursement as soon as January 1st of 2025. And then the adult services are expected to be available for reimbursement by winter of 2025. And again, these are the winter 2025 is a hopeful timeline. So we'll keep you all involved and updated as we move forward on that. Obviously, we are going to be having some stakeholder sessions, so stay tuned for that as well. And we do have an email address that I failed to mention in this slide, but I think it's mentioned in a later slide down the road. So I'll be sure to share that with you all. So with that, we'll move on to the next one. All right, I'm going to hand it over to Casey.
Thanks, Melinda. Good afternoon, everyone. My name is Casey Ingris, and I'm a chief in our compliance unit here at DHCFP. And so next, we're going to walk through some updates on implementation activities from the 82nd legislative session. Next slide, please. So before we get started, we did want to go over some of the Medicaid terminology that you'll hear in the next several slides and have probably heard already. One that you've probably heard a lot already is a state plan amendment. So the state plan is our contract with the federal government, specifically Center for Medicare and Medicaid Services, or CMS, that describes how the state administers its Medicaid and checkup programs. And so anytime a change needs to be made to the state plan, such as legislation being passed, we're required to seek federal approval from CMS to approve of those changes by submitting a state plan amendment. The MSM, or Medicaid Services Manual, is what sets forth policies for administering the Medicaid and checkup programs in accordance with our state plan, and the division adopts changes to that manual via the public hearings process in accordance with state law. The MMIS, or Medicaid Management Information System, is the federally approved system that we use for claims and prior authorization processing. And so when changes are made to the Nevada Medicaid program, there can sometimes be system updates needed to accommodate those changes. Our billing manual and billing guidelines by provider type are procedural documents that are maintained by our fiscal agent, and they provide support instructions for Medicaid billing, and they serve in concert with our Medicaid Services Manual. The fee schedule is a listing of reimbursable services as determined by our respective policy and benefit teams, and our rate analysis and development unit uses the methods and standards that are in the state plan to determine appropriate reimbursement rates for each service. A federal waiver is a request to waive certain federal requirements in Medicaid to allow states that provide healthcare options that are tailored to groups with particular needs and health conditions, and these waivers must also be submitted to and approved by CMS. And lastly, a request for proposal is part of the vendor procurement process, where the state solicits a vendor to perform certain activities related to the administration of the Medicaid program. Next slide. So this slide sort of provides a recap of where we're at with implementation efforts for legislative measures that were passed in the 82nd session. As you can see, we had about 52 bills that required implementation actions by the division. So we've been really, really busy since last session. Most of the bills have been fully implemented or are in the final phases. And so we're kind of dipping into phase 2 with the last of our bills to be implemented. And so at this point, we're going to walk through implementation updates for specific bills, and I'll hand it off to Jeremy Hayes to start us off.
Thanks, Casey. Good afternoon. My name is Jeremy Hayes. I'm the Chief of Rates for Nevada Medicaid, and I'll be giving the rates update for the bills of the 82nd session of the Nevada Legislature. Starting with AB 237, which increased nursing facility rates by 14.5%. This was approved on March 26th with an effective date of January 1st, 2024. AB 277, the designation for rural emergency hospitals, which is currently on RAI, or request for additional information, since October 15th. We're still pending CMS approval. SB 241, which implemented cost-based rates for critical access hospitals. This received approval on June 26th with an implementation date of January 1st, 2024. We do note here that cost-based rates for swing beds are still pending CMS approval. SB 504 had quite a number of effects for DHCFP, and so I'm going to take those individually, starting with applied behavioral analysis rate update, which only impacted certain codes, but is fully implemented. Next slide, please. The 5% increase to dental rates is fully implemented. The increases to certain codes in our frail elderly waiver is fully implemented. And the 5% increase to physicians' rates is approved and pending recycles back to January of 2024. Next slide. Rate parity for APRN and CNM with physicians is approved and recycles began on October 22nd. The 15% increase to home health private duty nursing facilities is fully implemented. And finally, for SB 504, the increase to various codes for assisted living facilities is fully implemented. Jumping back up to SB 511, which increased the minimum wage requirement for personal care services to a $25 equivalent with a $16 minimum wage. This is also fully implemented. And finally, for me, SB 280, unbundling long-acting retroactive contraceptives, or LARCs. Inpatient cause is on request for additional information pending CMS approval, and the FQHC unbundling for LARCs is also pending CMS approval. And with that, I believe I'm handing it back to Sarah Dearborn.
Thank you, Jeremy. So I'll talk a little bit about some of our benefit and coverage updates related to some bills. So first on the list is Assembly Bill 138. This allowed for reimbursement for behavioral health integration services, more commonly known as the collaborative care model. This state plan amendment was approved early October, and our system updates are in progress. Senate Bill 119 was related to telehealth services and allowing for audio only for mental health services. This has been fully implemented. Senate Bill 191 allowed for an age expansion for applied behavior analysis services, so no longer restricting ABA to under the age of 21, but now allowing for all Medicaid eligible individuals in need of applied behavior analysis. This state plan amendment was approved, and our system updates are very close to being completed. Next is Senate Bill 146. This allowed for certified nurse midwives to be able to be credentialed within hospitals. This has been fully implemented as well, and our MCO contract was amended and executed last December. Next, Senate Bill 439 was related to communicable disease coverage. This state plan amendment was approved and system work is in development. Senate Bill 504 related to our Medicaid budget bill. This allowed for Medicaid eligibility for pregnant women up to 200%. And CMS did approve up to 185%, and we'll be exploring additional federal authorities to be able to implement up to the 200 percent for the future. Next, Senate Bill 504, again related to a Medicaid budget bill, was the elimination of neurotherapy services. This state plan amendment is currently on pause, or what's known as request for additional information with CMS. And we're pending discussions around what the effective date looks like for that. Next slide, please. All right, Senate Bill 163. This allowed for coverage expansion for gender dysphoria and gender incongruence. And this state plan amendment was approved back in December of last year, and MSM updates were approved last year as well, and system updates have been fully implemented. Assembly Bill 277, which I think Jeremy talked about too, this has been fully implemented as well. Senate Bill 117 allowed for additional individuals to be supervisors for community health workers. This state plan amendment was approved last February, and MSM was approved. Currently, we are working on system updates to allow for that to occur within our system. Assembly Bill 155 related to biomarker testing coverage. This has been fully implemented as well. Senate Bill 221 was for reimbursement for specialty clinics for children, specific to cancer and rare disease, and this has been fully implemented as well. Senate Bill 232 related to coverage expansion of 12 months for postpartum care services. This has been fully implemented as well. And then lastly, Senate Bill 280 related to contraception provisions. This policy was updated last October and no system updates were needed. I'll pass it over to Kirsten.
Thanks, Sarah. So for our home and community-based services, bills from last session. So AB 208, that's our structured family caregiver waiver. That's a brand new waiver. So this will make it our fourth 1915C waiver. We did submit that on September 30th to CMS. They require 90 days to review. And so it's under CMS approval, and that effective date would be that January 1st, 2025. So we're on track for that. The other bill that we have that's still pending is AB 259. So that is with our 1915C home and community-based waiver for individuals with intellectual and developmental disabilities. So that's actually adding a new service. We did submit that earlier in October, and we just had our 15-day call with CMS last Friday. So that is currently being reviewed. That also has an implementation date of next January 2025. So that is on track. We did implement the personal needs allowance. So that is for individuals that are in nursing facilities. So that was effective January 1st, 2024. So that increased their personal needs from the $35 up to the current amount is $154. And then we'll adjust due to cost of living each year. And then the other two related to SB 504. So we did have the rate increase for the recipients on our IDD waiver. And so that actually, we had two kind of rate increases with that. So one went into effect last July, and then kind of phase two of those rate increases went into effect April 1st of this year. And then we also increased the waiver slots for our waivers. And so those were all implemented and approved. And I will hand it over to Jessica.
There we go, unmute. Good afternoon, this is Jessica Venucci. I'm the Durable Medical Equipment Program Manager here within Pharmacy and DME Unit. Bill AB 156, expanding pharmacy prescribing authority, was effective January 1, 2024, and it's fully implemented. SB 504, the wearable cardiovascular defibrillators, effective January 1, 2024, also fully implemented, currently in post-production testing. MSM Chapter 1300, the DME policy updates were updated effective May 1, 2024. Additional updates are in progress due to DME provider feedback and audits completed this last quarter. We're adding breast pumps and supplies to cover benefit coverages. It's in progress. This will include manual, electric, and hospital-grade options under a range of different provider types. The expected implementation is January 1, 2025. SPA progress for value-based contracting within the pharmacy benefit is currently in progress. Updates to COVID product, vaccine, and test coverage in place effective January 1, 2024. Thank you so much. Now, Joseph Philippi.
Thanks, Jessica. Good afternoon, everyone. My name is Joseph Philippi, and I serve as the Executive Director for the Nevada Patient Protection Commission. And for those that don't know, the PPC is a governor-appointed public body. It operates within the Department of Health and Human Services, and now it's going to be within the Division of Healthcare Financing and Policy. So membership of the commission is comprised of different representatives from across the healthcare spectrum. It includes advocates, providers, and industry professionals who are all dedicated to improving healthcare in the state. The PPC is responsible for coordinating and collaborating with state agencies such as Medicaid and others to systematically review issues related to quality, accessibility, and affordability of healthcare in the state. The commission is required also to provide a report with recommendations to address any issues that they identify, and this report must go to the governor and the legislature every 6 months. So earlier this year in April, Governor Joe Lombardo issued an executive order that directed the commission to make recommendations aimed at addressing the state's healthcare workforce shortage so more patients have access to quality healthcare statewide. Over the past 6 months, the commission has been reviewing available data, state data and national data, and other best practices to develop initial recommendations to address the healthcare workforce challenges. The initial recommendations are planned to be included in the Commission's next report, which is due January 1st of 2025. In addition to the report, NRS 218D.213 provides the Commission with authority to submit up to 3 legislative measures, also known as bill draft requests or BDRs, and they can submit those in relation to anything that's within the scope of the commission. And so in August of this year, the commission submitted 3 BDRs for consideration during the upcoming 2025 legislative session. The intent of each of those BDRs is to address the healthcare workforce shortage in various ways. And just to give you a brief overview, the first BDR would establish a workforce fund within Nevada Medicaid to support and expand graduate medical education and other workforce programs. The second bill draft request would request Nevada Medicaid establish value-based payment models and increase certain provider reimbursement rates. And the third BDR would seek to streamline the licensure onboarding process for certain providers by enacting multiple interstate licensure compacts. For those interested in learning more about the Commission's activities, feel free to visit our website, which the link is at the bottom of this slide. And then also, just for your information, our next meeting is going to be held virtually on December 13th at 9 a.m. And with that, I believe it's back to Melinda.
All right, thanks, Joseph. Okay, so this slide, we really wanted to give you all an idea of some of the main stakeholder tables that we have going on right now, and just different opportunities where you could possibly engage on different topics that the division is exploring. So first on this, we have our reentry initiatives, and there it is, that lovely email that I was talking about earlier. So we're looking at having our stakeholder work groups begin in early 2025. And so if you're interested in being a part of that, please do email that email address, and we'll be sure to include you on our list. Also, we do have 2 public workshops coming up, one this week and then one next week on our 1115 reentry waiver application. So right now the application is posted for public comment, and we invite your feedback during those public workshops. Next group we have is the Children's Behavioral Health Transformation that Anne had went over. And so we do have working group meetings that are ongoing throughout 2025. And then we'll have some additional community meetings that will invite additional stakeholder input and feedback starting this winter. So again, if you're interested in that table, please do email that email address. Next, we have our school health services program. So we are working on a new school health services comprehensive manual that we are anticipating taking to our December public hearing. And we are also working on a school health access resource center along with the steering committee. And so we're going to begin comprising that steering committee, starting the meetings actually at the end of this month. And that steering committee is really going to help to advise the division on our activities related to school health services and how we can improve that program and improve access to those services for kids. So if you're interested in anything there, again, another email address for y'all. And then we also have our regular ongoing stakeholder meetings that the division holds with our various partners listed here. So if you're interested in learning more about any of those, please do email the community and provider engagement unit at that email there. Next, we have our tribal stakeholders. So the division hosts quarterly tribal consultations. We've also gone on various in-person tribal outreach visits and have held some ad hoc tribal consultation meetings on specific topics that may arise that that we would like to seek additional consultation from. And I listed our tribal liaisons information here in Hy-Vee. Please feel free to reach out to her if you have any questions related to anything having to do with our tribal outreach. And then lastly on this slide, we do have some December behavioral health public workshops that are coming up. So listed those here for your awareness. You're always welcome to go to our public notices website for the public workshops and public hearings that are all listed there. And again, we invite your feedback at any of those venues. And then happy to announce we're going to keep these stakeholder update workshops ongoing. So we hope to have at least maybe 2 a year ongoing, just to provide these general updates for you all.
Melinda, you got onto mute somehow.
Geez, thank you, Monica. All right, so this is the point where we turn to you all and ask for your feedback or any questions that you might have. Please feel free to use the raise hand feature in Teams, or you can press *5 on your phone if you're joining us from the phone. And so please do, ask any questions or give any feedback. And let's see, I see Pat, you have your hand raised. Please go ahead.
Thanks, Melinda. Really appreciate these updates. They're fantastic. But I have a question about the private hospital Medicaid provider fee program. And, we submitted the preprint for Model I, and I just wondered if you've heard anything from CMS as to, when we could expect approval or if they've asked any questions. And then finally, I'd like to know if they have to make the decision before the end of the year.
Well, unfortunately, we can't control them. I would hope that they make the decision by the end of the year. I think that they seem to be, they did respond, and I had a few questions. We did respond back. So I think we're just waiting for them. I'm hopeful it will be approved, but I can't make any promises, Pat, but let's hope for January and try to maybe leave on that note. But we'll definitely keep you guys posted if we hear anything else.
Okay, thank you.
Yeah, you're welcome.
All right, any additional questions, comments, feedback? All right, I'm seeing none. So I did want to also bring your attention to a feedback survey link that we have here. So if you'd be so kind as to please complete a survey. It's very short, I promise. Just asking for, how we can improve these moving forward. So really appreciate any feedback that you can offer there. And let's see, I think that is all the slides that we have. So Stacy, I don't know if you wanted to provide any closing comments.
No, I think this is all of it. So thank you all for joining us today. And obviously let us know if you need anything. You know how to reach us, hopefully. But thank you again. Oh, Kai, I see your hand is up.
You may want to copy this link and paste it in the comments here because it's not clickable in the slide.
Thanks, Kai. Melinda, do you want to copy paste it over?
I sure will. Oh, and I also wanted to mention that we will be posting the slides from today's presentation on our public notices webpage along with the recording. So you all will have access to that.
Thank you, guys. All right, Melinda will drop that in. Hope you all have a great day and thank you.
Thanks, everyone.
Bye.